It's your girl Nurse Channie here with a new video this week. So a few weeks ago I started a new series where I am talking about OB nursing, labor and delivery nurse, postpartum nurse, and all those good things that you guys come here to my space to talk about. So wait, can we just shout out my new plant babies? So I've become a plant mom. I'm a mom again. How appropriate for this video. Hold on, let me get comfortable. So yes, I'm a new mom again. I have 2 plant babies, and if you know me, you may know that I don't have a green thumb. I have a black thumb. So I have been known to not be so nice to a plant or two, but these I am trying to learn how to cultivate them and grow them just like I would any of the babies that I take care of. So stay tuned for that. Maybe we'll get into some lifestyle content where I am talking about or soliciting help as to how to take care of these babies, okay? But today we are talking about the role of the labor and delivery nurse. And so I thought it was important to differentiate. When we talk about OB nursing, I thought it was important to really kind of hone in on what does that really mean. And women's and infants really encompasses a lot of things, because it also encompasses newborn care and NICU care. Today, we're talking about the role of the labor and delivery nurse. So if you want to hear more about what we do as L&D nurses, keep watching. New here, I am Chandra, aka Nurse Channie, and I am a labor and delivery / postpartum travel nurse. I've been doing this for about 12 years and I absolutely love this specialty. So today I kind of want to talk about the role of the labor and delivery nurse and just share a little bit about what we do as labor and delivery nurses. So I have to tell you, my passion for this started when I was a teenager. I saw my first live birth and delivery when I was probably 15 or 16. My friend's sister had a baby at their house. It was very unexpected. It was the most amazing thing that I ever saw. Like, I was just like, oh my God, that was amazing. Like, just watching new life come into the world, like, oh my God, it was so amazing. And so as I grew up and continued to think about what I wanted to focus on in my nursing career, it was like a no-brainer. Definitely, labor and delivery is where my passion was. And one of the other things that inspired me to begin a career in labor and delivery nursing was my own labor and delivery experience with my first child. It was the worst experience ever. I shouldn't say it was the worst. It just wasn't a great experience for a first-time mom. So I was a teenage mom, a young mom, and I think that my nurse had a lot of perceptions about me, which can play a role into how we care for people. And so, to put it plain, she just wasn't nice to me. She wasn't supportive. She did not meet my needs at all. That is one of the most vulnerable times in a woman's life, and you need all of the support. You need a cheerleader. You need people to champion for you, to tell you that you can do this hard work. For all my moms out there who have delivered a baby, you know how difficult that process is. So your labor and delivery nurse needs to be someone who understands what you're going through and understands the amount of support that you need in that moment. And so As labor and delivery nurses, a lot of what we do is support our patients during their laboring process. As the labor and delivery nurse, you're going to be asking your patients questions about their health history, questions about what kind of birth or their expectations for the birth, because that's very important to know whether or not this mom or this family has a birth plan. Because if they do, you want to discuss that with them, and you want to be able to support them as much as you can in the process of meeting their needs. Because at the end of the day, it's all about the patient and their experience. And safety. Safety is a big thing, and I'm going to get into that. But you want to be able to support your patient. So how do we learn how to support our patients? We ask them what it is that they need. So having that conversation is super important when you are a labor and delivery nurse, okay? So number 2, as a labor and delivery nurse, I act as an advocate for my patient. If there are things that are going on in the labor and delivery process and I feel like, again, my patient needs support, it is my job as the L&D nurse to advocate for my patient, to be that connection between the patient and the provider, making sure that the patient's needs are being met. Number 3, we are assessing our patients. There is a special set of skills that you need to assess your patient while they're in labor. And the reason being is because you're caring for 2 people. So not only are you assessing your mom, you're also assessing that baby. And the challenging part about that is we can see mom, we see exactly what's going on with her. She can express when she's in pain. She can express when she needs something. We can have a conversation with her. We can assess her needs. However, with the baby, we can't assess everything that's going on with the baby. So what we do in labor and delivery is we use fetal monitoring to assess our baby. So when our patient comes in, we typically will attach 2 belts to mom's belly. One is to assess the baby's heartbeat. The other one is to assess her contraction pattern. And as a labor and delivery nurse, if you're working in that environment, you're going to get extensive training to teach you how to assess both mom and baby and what kind of interventions you need to implement in the event that our baby is not looking the best when we're looking at that fetal monitor tracing. Now, fetal monitor tracing is not something that I can get into on YouTube because, again, it is very extensive training. But just know that if you begin a position in labor and delivery, you're going to get or you should get about 12 to 14 weeks of training to teach you how to assess the fetal status and what kind of interventions you need to implement if things, again, are not looking the way we want them to look. Okay? So doing thorough assessments on your mom and baby are a big part of the job when you are a labor and delivery nurse, okay? Number 4, this is 4. Number 4, we are educating our patients in the labor and delivery setting. As a labor and delivery nurse, it is your job and your role to educate your patient. So there's lots of things that you're going to be educating your patient about in the labor and delivery suite or in the labor and delivery setting. So you're going to be educating them about this whole process. I always like to educate my patients because being in the hospital is kind of fearful. If you've never been in the hospital, you have this anxiety as a patient. And so as the nurse, I think it's very important for me to kind of decrease your level of anxiety as much as I can by educating you about what's going to happen during this process of labor and delivery. So for me as a nurse, it is very important that step by step, as I'm performing tasks or doing things with my patient, I'm always educating them along the way. So if I'm asking them questions, I'm educating them as to why I'm asking you this certain for a specific set of questions. If I'm performing a task like drawing your blood, starting an IV, putting you on the fetal monitor, giving you medication, I'm always educating my patient as to why we're doing that, because we take for granted, because we're nurses, that the patient knows this is why we're doing something, but that's not always the case. And so I think it's important to always educate our patients so they are, one, part of the process, because again, this is their experience and you want them to have as much information that they can digest as possible. Okay, you don't want to over educate them using all these big medical words and all this medical jargon, but you want to educate them as much as you can, and you want to let them know what's going on. There's nothing worse than being a patient, because this has happened to me as a patient. There's nothing worse than being a patient and people performing tasks on you or doing things and you are feeling like, what is going on? Why is this happening? What's the tea? So I always feel like it's important to educate my patient as I'm doing things for them or to them. I hope that makes sense. You want to educate your patient about medications. There's lots of medications that you're going to be giving your patient that they probably have never had before. And as a nurse, it's always important that we're educating our patients about medications that we're giving them, what the expectation is, what kind of side effects they may encounter as a result of taking that medication. Those things are important. We're educating them about the actual birth process and what things are going to happen. There's different stages of labor that your patient is going to go through. It's important to educate them about those stages of labor. Labor, if you've never been through it, it's like a foreign thing. And you start out one way in this first stage of labor where you're happy-go-lucky, you're able to communicate with your family and your healthcare providers. Then it starts to get kind of like, okay, things are changing. I'm getting more pain, more contractions. What's going on with my body? And then that last stage of labor is the most painful part, where you're going through that transition right before birth. And so these are things that we're educating our patients about. You're going to go through different stages and different moods as this process continues. And then the biggest thing that we are doing in terms of comfort for our patient is we're providing comfort measures for our patients. Labor is painful. It is a very painful process, and some people elect to have a natural labor without drugs or medications, and they just breathe through it and get through their labor that way. As a labor and delivery nurse for those patients, you have to be there with them to be as supportive as possible, changing their position, offering them different comfort measures, whether that be a cool compress on their head or changing their position, a back rub. Those are some of the things that the labor and delivery nurse is doing. You're also going to be educating your patient about their options for pain management. Labor is painful. Again, it's tough. It's rough. And I know because I've been through it, but I also know because I see my patients go through that painful process. And so it is your job as the labor and delivery nurse to really educate them and talk with them about what their pain management options are. So it's not our job to push that on the patient. It is our job to educate them so that they can make the best decision for their labor process. Now, I personally have never had an epidural, but I have assisted with placing many in epidural, and they look like they work so well. Like, I see my patients go from crazy, rolling around the bed, just out of control, to when they get that epidural, they are loving life. So I wasn't a nurse when I had my children. I wish somebody had told me, sis, just get the epidural. One of the things that I forgot to mention in the role of the labor and delivery nurse is also being in the operating room as a circulator or scrubbing in a C-section case for a patient. So the labor and delivery nurse is also trained in one or both of those roles. Oftentimes there is a scrub tech working in the hospital. So majority of the time, the labor and delivery nurse functions as a circulator in the operating room should a patient have to deliver via C-section. And what that means as a circulator is you are basically in charge of making sure that the operating room is running appropriately. You're going to be making sure that the instruments on the delivery table are accounted for. You're going to make sure all the materials that are being used for the surgery are accounted for. You're going to be assisting the physician and the scrub person for anything that they may need to add during the surgery. You're going to be assisting anesthesia with giving patients medications or whatever they might need help with. And then after your patient delivers via C-section, typically you're going to be the one in the post-acute area or the PACU recovering your patient after surgery. So in a nutshell, that is what we do as labor and delivery nurses. We are there to support our patients in their labor process. We are here to communicate with physicians and advocate for our patients. We are going to be there to make sure that we are assessing our patients and really honing in on our assessment skills to intervene if necessary, if there are things that we determine are not going well during this labor process. And we're there to educate our patients about what's going to happen during this labor and delivery process. And we're here to educate our patients about this whole process, which is a whole lot, okay? So I summed that up in like a 15-20 minute video, but being a labor and delivery nurse, it comes with a lot of responsibility. It's one of those specialties that you either love it or you don't love it. And so as a nurse educator, whenever I meet a new group of students, I either have a pocket of students who are like, this is what I want to do, absolutely, this is my calling. And then I have another pocket of students that are like, I'm just trying to get through this clinical rotation. I have no interest in laboring or delivering with a patient. And that is okay. And that's the beauty of nursing. There are so many things out here that you can focus on as a nurse. So if labor and delivery is not your thing, that's totally understandable. That's the beauty of nursing. You get the opportunity to call the shots in your career and make it what you want it to be. That is one of the greatest things about nursing. It offers so much flexibility. And so I hope you guys enjoyed this video. Please jump down in the comment section and let me know if you are a labor and delivery nurse and you want to add to this conversation. Feel free to do that in the comment section. If you want to share this video with someone who aspires to be a labor and delivery nurse, I encourage you to do that also. So nursing is not just my job, it is my passion. And I thank you guys so much for watching this video. Please like, please share, hit that subscribe button if you are not subscribed to the Know It All Nurse channel. This is a channel where I talk about nursing information, lifestyle content, and my goal is to inspire you to live and be your greatest self. So thanks so much for watching, and I will talk with you on the next one. Peace out.